Everybody, this is Dr. Donna Barros of the Thought Word Academy, but coming to you today just as a woman who has been trying to get pregnant again. So this is a video I was hoping I wouldn't make. However, here I am, and I thought maybe it would be helpful for those who are going through the process and might be, wondering about what the cycle might look like and what to consider. So I wanted to share. Now, I had a 6-day embryo. My beta was supposed to be on day 9 post-transfer, which would be 15 days past ovulation. But because we had a hurricane down here, I never got to do that beta, but it didn't matter because the day after I got my period anyway, so it was already done. So with all that being said, I was tracking my period, and I think I can even include in here the testing that I was doing, the daily testing. Didn't get any lines at all. Normally I would have a line and just wait for it to be darker because I was taking the HCG daily booster shots, but this time I just done a trigger, and so by the time I started testing, the HCG had already tested out of the system. It wasn't there anymore. So it was very, very heartbreaking. This was the last embryo I had made from this cycle, so now I'm gonna have to go through the whole process to make new embryos again, which is exhausting and expensive, as everybody in this process probably knows. But anyway, with all of that being said, there's it's hard to tell sometimes when you're going through the process if what you are experiencing are pregnancy symptoms, or if they might just be symptoms from all of the hormones you're taking. But because I wasn't taking any hormones, I was under the impression that anything I was feeling was probably me being pregnant. So, just know this was a failed cycle, but I still want to make you aware because sometimes you think, you're having these symptoms and it may not be what you think it is. So, I know that there are some videos that I watched with some people, but they were actually taking the hormones. There wasn't a lot of videos that I've seen out there for people who are doing a natural cycle. So I just wanted to make you aware. I wrote them down on my phone. So I just wanted to share with you, so when I say natural cycle and hormones, the only thing I was taking was progesterone twice a day. I wasn't taking any estrogen. HCG had already been out of my system. I was taking prednisone. It's not a hormone, obviously, but just to be aware of anything else that I was taking. That was it, and baby aspirin. So day 1, 9 p.m., I felt uterus pulling sensation. Day 2, 7 a.m., I was coughing, and I felt like my uterus was really tight. By 6:30 p.m., I just wanted to sleep. I was exhausted. I had had heartburn all day, mild cramping, and then 11 p.m., I was starving. Day 3 past, so this day 3 past transfer, right, which would be 9 days past ovulation. I had heartburn again. I had very sensitive gums. My teeth actually hurt to brush them. I felt heaviness in my uterus, like especially if I was like jumping up and down, like I wasn't really jumping, but like, well, I was a little with my daughter. My breasts were very sore. By 8 p.m. I wanted to sleep, and 1 a.m. I woke up and I was starving again. Day 4, I woke up crampy. I sat up with a real tightness in my uterus. I felt exhausted by 4 p.m. Pushed through the day, then felt exhausted again by 8 p.m. And I even felt slightly nauseous. Day 5, I woke up, I had felt pinches, which would have been 11 days past ovulation, which would really be, I think too late to feel implantation symptoms. I'm just sharing with you what I felt. I had no appetite all day. I had stayed kind of nauseous feeling from the night before. Then by 7:30 p.m., I was exhausted. Okay. So then day 6, right, which would be 12 days past ovulation, my uterus was still feeling tight. I still had heartburn. I felt very tired. My appetite had returned. And oddly, I was feeling a little bit more sensitive to smell. Now, when I had this super smell when I was pregnant, that wasn't until I was like easily 8 weeks pregnant. So I didn't think it was that. I just thought maybe I was just feeling very, very sensitive. Day 7, I was very tired again. Breasts were very, very tender. And again, I had cramping. But they didn't feel like the normal cramps for my period coming. So that's why I really wasn't sure. Now, by day 8, right, which is 9, 10, 11, 14 days past ovulation, I knew the next day was going to be the beta. Was supposed to be the beta. I hadn't got any lines on any of my tests, and I was already feeling like this was a 1 in a million chance if I was going to be pregnant. So at this point, I really felt like whatever symptoms I was having was probably just my period gonna come. I was still hoping against all hope. Maybe I was wrong. Maybe I'd implanted late. Maybe there just wasn't enough HCG to show, because when I was pregnant with my daughter, and that as well it was 15 days, but it was a 3-day embryo. So by the time we tested, it was 12 days past transfer. And I only had 81 for my HCG. And then, of course, it doubled, and, the rest is history. Here she is. But it was very low. And if you think about it, had I tested 2 days before, which I had, but again, because I was taking the HCG shots, I was always going to see a line. It was doubling. It was only going to be maybe around 40 or less. A few days before, so may not have even showed up. And that's kind of what my mindset was maybe it wasn't showing up yet. Anyway, so day 8, I really did write a lot because I was feeling very down. I was getting very depressed. I really wasn't feeling positive. Just feeling some cramps, exhaustion again by 4 o'clock, heaviness, and just wanting to sleep early. So those were my symptoms, and that was what I had experienced. And my period did come, and it was on day 10. So 9 would have been my HCG test, and day 10 my period came, which normally if I was on the hormones, it wouldn't have come until I had gone off the hormones and off of the HCG shots. So I just wanted everyone to, who's watching this, just to be aware that these are symptoms you can have that seem a lot like symptoms of pregnancy. And I'm not in any way saying this to be negative or to make people feel like they don't have hope. I'm just trying to bring awareness, because I didn't think I would have had any of those feelings unless I was actually pregnant, and I'm not. So, just to bring some awareness to everything. I know that they say to not test, during the 2-week wait, and that's a personal preference. I think that there are a lot of people who don't, and God bless them. If you don't do it, that's great. If you can hold out, I guess I just don't want to be shocked. I kind of want to be in a place of expectation, have a little twinge of hope, but be in a place of expectation that things, there still might be something that I could hope for, but be aware that it's likely more than not. So anyway, with that being said, so now I'm in the process of having to go through everything that's entailed in trying to start over again. So hopefully that will happen in the next few months, and then I will be back again to report. This time I am very, very carefully going to make sure that the embryologists do not make the embryos grow past a 3-day. I did not want them to do it this last time. They, for some reason, did not read my email, and I would have had, I think 5 3-day embryos, and I ended up having only 3 that were 5 and 6 days, which I didn't want, and didn't work. So not to say that 5 or 6 don't work for people. I'm sure there are lots of people who do. I know there are people who prefer to have blastocysts of that age. I don't. So we'll see. Hopefully we'll have some good news soon. So I will be checking in again, at least with that progress when embryos are made and what we get. And I'm hoping and praying that everybody out there will have positive results. This is such a hard journey. It is so filled with loss and the roller coaster of hope and pain and joy and sorrow. It's everything all together. And everybody who's in this process, I know what it's like, and it's not easy, and it's not for the faint of heart. So with all that being said, thank you for your time. Please like, subscribe. My channel has other videos as well that I do in reference to my coaching. You can see things just basically on any metaphysical practices that I have. There's coaching for weight management. There's coaching for relationship, and of course, IVF as well. And if anybody out there, has any concerns, needs some help or some support, wants someone to talk to, who can help to advise them and has gone through it themselves with the emotional components, that's what I do. So you can reach out to, this contact here, and I'll be there to help in any way I can. So thank you again for watching. I wish everybody out there much success. I send all the sticky baby dust and really hope and pray, that you will have a successful cycle and a positive journey on your way to motherhood. Thank you so much. Take care, be well, and namaste.